Well, a rare discovery on a St. Paul mother's 20-week ultrasound meant a difficult decision. Surgery on the baby in utero, or the possibility he would not survive after birth. Our Sarah Danek has the incredible story of baby Jabari and the doctors who guided the family through all of this.
There's incredible excitement ahead of a baby's birth, but sometimes those 40 weeks don't always go as planned.
Found out about the ludo, lower urinary tract obstruction, at his 20-week ultrasound.
Trina and Bach learned extra tissue was blocking their baby's bladder,
A little chunk.
so no urine was passing through, meaning no amniotic fluid created to help the baby develop.
He pointed out on one of the photos, the bladder was really enlarged. It was like the size of his head at that point, and at 20 weeks, you're not supposed to see the bladder at all.
The couple would soon learn that the rare birth defect would mean their unborn baby son might not survive without some medical intervention.
It was really hard. It was a really difficult conversation to have, and like a really difficult reality.
They met with Dr. Saul Snoweyes, the medical director at the Midwest Fetal Care Center, a partnership between Allina Health and Children's Minnesota.
And long and short of it is, without that fluid around the baby, it can be lethal to the baby if it isn't treated.
Dr. Snoweyes explained baby Jabari needs that fluid to help develop the lungs. And if the lungs aren't developed, the infant won't be able to breathe. Their option was an in utero surgery, where a shunt would be inserted into the baby's bladder.
What we want to do is create a bypass, allow the urine to get into the amniotic cavity, to allow the lungs to develop and for the pregnancy to continue.
The procedure was done at 21 weeks at the Midwest Fetal Care Center in Minneapolis. You can see in this diagram how it worked. Dr. Snoweyes used a special needle to go through Trina's abdomen, through the uterine wall, and then insert the shunt into the baby's bladder, guided completely by live ultrasound images.
Trina had a roughly half-centimeter incision. Everything's done under local anesthesia with just a little bit of IV sedation. She went home the same day, so it's minimally invasive.
The surgery was a success, and baby Jabari, whose name means brave, was born at 34 weeks with fully developed lungs.
Going from we were going to lose him to actually seeing him, I cannot explain that. I was just trying not to cry in front of millions of doctors.
He's had to have one surgery since birth and will need another when he's older, but the future looks bright.
We are just glad he's healthy and safe.
For the brave little boy.
It's a true privilege to be able to partake in this and give patients who otherwise may have not had hope for any type of outcome to actually have good outcomes and good long-term outcomes.
Sarah Danek, Fox 9.